Hello, everyone. Let's talk about Medicare. Medicare is a crucial part of your retirement planning. Medicare is a health insurance program for people 65 and older, and some younger people with disabilities. It helps pay for your health care, covering services like hospital stays and doctor visits. Understanding your Medicare costs is important. It helps you avoid surprises and plan for your future. Medicare has different parts. Part A covers hospital insurance, while Part B covers medical insurance. Knowing these costs helps you make informed decisions and manage your finances. Understanding Medicare ensures you get the care you need and gives you peace of mind. So let's dive in and learn more. Understanding Medicare is the first step to a healthier, happier retirement. Medicare Part A covers you in the hospital. This includes inpatient care, which means you are admitted to the hospital and stay overnight. It covers your room, meals, nursing care, and other hospital services and supplies. It also covers skilled nursing facilities. These are places where you can receive specialized care and rehabilitation services after a hospital stay. You might need this after a hospital stay if you require additional care to recover fully. Skilled nursing facilities provide a bridge between hospital care and returning home. Part A has a deductible. This is the amount you pay out of pocket before Medicare starts to pay its share. In 2025, it's $1,600. This deductible applies to each benefit period. This is what you pay before Medicare pays. After you meet the deductible, Medicare covers most of your hospital costs. You pay this each benefit period. A benefit period starts when you're admitted to the hospital and ends when you haven't received any inpatient care for 60 days in a row. A benefit period starts when you're admitted to the hospital. This means that if you are readmitted within 60 days, you don't have to pay the deductible again. It ends when you're out for 60 days. If you are readmitted after 60 days, a new benefit period begins, and you will need to pay the deductible again. You may also have coinsurance costs. Coinsurance is a percentage of the cost of your care that you pay after you've met your deductible. This is the amount you share with Medicare. For example, you might pay a certain percentage of the cost, and Medicare pays the rest. For example, you may pay 20% and Medicare pays 80%. This cost sharing helps manage the expenses of your care. These costs can add up. It's important to be aware of all potential expenses so you can plan accordingly. It's good to know what to expect. Understanding your Medicare Part A coverage can help you make informed decisions about your health care and manage your finances better. Most people get Part A for free. You qualify if you worked for at least 10 years. This work must be in the United States. You also qualify if your spouse worked long enough. If you don't qualify, you can still get Part A. You will have to pay a premium. The premium depends on how long you worked. It's important to check your eligibility. You can do this on the Medicare website. Section 4. Medicare Part B, covering doctor's visits and more. Medicare Part B is for outpatient care. This includes doctor's visits. It also covers preventive care, like screenings. Part B helps pay for medical equipment too. Part B has a monthly premium. In 2025, the standard premium is $170.10. You also have a yearly deductible. In 2025, it's $226. This is what you pay before Medicare starts paying. Like Part A, Part B has coinsurance. You usually pay 20% of the Medicare-approved amount. Medicare pays the other 80%. Understanding these costs helps you plan. Section 5. The price of procrastination, late enrollment penalties. It's important to enroll in Medicare on time. If you don't, you may pay more. These are called late enrollment penalties. They can be costly. For Part A, the penalty is added to your premium. It can be 10% higher for each year you delay. For Part B, it's 10% of the premium for each 12-month period you were without coverage. These penalties last as long as you have Medicare. Don't delay, enroll on time. Section 6. Beyond the basics, costs for additional Medicare services. Understanding the full scope of Medicare coverage is crucial for making informed decisions about your healthcare needs. Medicare Part A and B cover many essential services, such as hospital stays, doctor visits, and preventive care. but they don't cover everything. There are significant gaps in coverage that can lead to unexpected out-of-pocket expenses. For example, they don't cover long-term care, which includes services like nursing home care or assisted living facilities. You may need additional coverage to fill these gaps. This is where Medicare Part C and D plans come into play. Medicare offers Part C, also known as Medicare Advantage, and Part D plans. These plans are designed to provide more comprehensive coverage. These plans help cover additional services that are not included in original Medicare, such as dental, vision, and prescription drugs. Part C plans are offered by private insurance companies and can include a variety of additional benefits. They may cover services like dental and vision, which are not covered by original Medicare. Part D plans specifically cover prescription drugs, helping to reduce the cost of medications. However, it's important to note that these plans also have different costs and coverage options, which can vary widely. There are also other services not fully covered by original Medicare, such as mental health services, home health care, and hospice care. These include mental health services, home health care, and hospice care, which are essential for many seniors. These services have their own costs and requirements, which can add up quickly if you're not prepared. It's important to understand these costs and plan accordingly to avoid any financial surprises. You need to know what to expect if you need these services, so you can make the best choices for your healthcare needs and budget. Section 7. Your Medicare Journey, Understanding Your Costs and Coverage. Understanding your Medicare costs is crucial. It helps you make informed decisions. It also helps you budget for your healthcare needs. Remember, Medicare is there to help you. Take the time to learn about your coverage. Ask questions if you need to. The more you know, the better prepared you'll be. Remember, knowledge is power. For more information and personalized guidance, subscribe to our channel. We're here to help you navigate the world of Medicare.